I'm speaking to a clinical nursing conference to RNs. Let me first begin by telling you a story. A new nurse on orientation, she's walking with her charge nurse through the hospital unit, and she notices some normal things, but then she notices something very out of place. She notices a doctor shouting random words, like tetanus, flu, and morphine. Puzzled, she looks at the charge nurse and says, "What's up with this guy?" Well, the charge nurse just looks at the nurse and just shrugs it off and says, "Oh, don't mind him. He thinks he calls all the shots around here." Okay, so that was my attempt at a joke. Obviously, I'm not the best at telling one, so why tell one? Because chances are that even if you didn't laugh, you did smile, or at least you appreciated that I was trying to make you laugh or smile. And whatever the case may be, you can appreciate that effort was made. And in harmony with this, I wanted to share with you the clinical benefits of laughter in medicine. According to Dr. Jody Gottfried, she does say that very fact, laughter is good medicine. In fact, numerous studies support that the benefits of laughter in cardiac rehabilitation, the benefits of laughter in pain perception, discomfort threshold, coping and stress, and importantly, immune response. She goes on to say that laughter does more than to provide a coping mechanism for facing major illness, but it can reduce stress hormones and boost the immune system. So clearly, studies go on to report that these laughter in medicine can be of great benefit. So much so is it beneficial that even in pediatric hospitals now, they employ the use of clowns. As nurses, we recognize the need to treat the whole person, and in these pediatric centers, that's exactly what they do. They use clowns to lighten the mood if a child's getting a shot or procedure or blood draw or even, heaven forbid, a cancer treatment. These are used to to reduce the stress in the children, and not just the children, but also the parents of the children. Because let's face it, you hate to see your children suffer. So anything to give some levity, to lighten the mood, to release some of that stress and some of those feel-good hormones, anything like that is critically important. Further, we have to appreciate that while laughter can help, we need to have balance. Obviously, we don't want to make light of someone's situation if they just got a diagnosis of cancer. We don't want to tell a joke and make light of that or fun of that, of course, because then that would convey a very careless attitude. But rather, humor can be appropriate. It can show some compassion, and it can help someone cope with the very stressful situation of being in a hospital, having treatments, and facing difficulty. In fact, Dr. Fry went on to say that humor is a tonic that anyone can afford. So there you go. Doesn't even affect our benefits or copays. It's free. And Dr. Goodman also said that it helps to cope. A sense of humor helps to get through the bumps in the road, and it can help deal with difficult situation and goes along with a positive attitude that's part of a self-fulfilling cycle. So Dr. Goodman was helping us to appreciate that if we pay it forward, so to speak, and help someone get through a situation, then we benefit ourselves, don't we? Well, how do we incorporate humor? Well, Dr. Gottfried, in his journal conversation about therapeutic humor, he went on to say that on a regular basis, we can take in doses of funny films, joke books, watch comedians, look through the humor section of a library, things that we have access to like that, or even on the internet, funny stories or anecdotes. All these things, by exposing ourselves to different types of humor and so forth, we will have these little tidbits to share to lighten the situation. And of course, like I said, we don't want to make light of a difficult situation, but if we can employ humor to help to incorporate in our care of the whole person, that is what we should do. So my suggestion to you is read something funny, share something funny, give your patient something to lighten their mood. And I know that if we all make the effort to do that, then our care will really come through. So go tell a joke. I know you can do it.